Good afternoon, everyone. I'm Zack Kucharski. I'm the executive editor of the Gazette in Cedar Rapids, and I would like to welcome you to our first in-depth week for Iowa Ideas in 2024. This week's focus is on homelessness, and today's session will be homelessness and vulnerable populations in Iowa, and we will be looking and talking about things, the situation in the state and beyond. I'd like to open by giving some sponsor recognition to ITC Midwest. They are our presenting sponsor again in 2024, and we are thrilled to have them with us again as part of the project. I am joined today by Mary Frances Kenion, Courtney Gruntly, and Tim Wilson, and I'm going to have Mary, if you want to start with introductions, we'll go from there.
Sounds great. Thank you so much for having me, Zach. I'm super excited to kick off Iowa Ideas in depth with the fellow panelists today. My name is Mary Frances Kenion. I'm the Vice President of Training and Technical Assistance at the National Alliance to End Homelessness. We're a nonprofit, nonpartisan organization that's committed to preventing and ending homelessness in the United States. So I'm hoping to bring that national lens today. And the team that I lead is really where we see best practices that are informed by an evidence base of research, where we take that and turn it into actionable implementation at the systems and community level. So we're really about helping programs and systems increase their performance so that homelessness can ideally be rare, brief, and one time.
All right, thank you. Courtney, would you like to go next?
Hi, everyone. Thank you again for having this session around homelessness and for inviting me to be part of it. My name is Courtney Gruntly. I am the Iowa Balance of State Continuum of Care Director. The Balance of State covers 96 of the 99 counties in Iowa, and we are the planning organization for these homeless support services in those 96 counties. The 3 counties that we don't cover are Polk, Potawatomi, and Woodbury. Those counties do have their own continuums of care, and I think you'll be hearing from some of those individuals, those directors, later this week. So we run a funding competition in our continuum of care, and we really are thinking strategically around how we can end homelessness and support the agencies that are doing that work across our balance of state.
Tim.
Good afternoon, Zach, and thanks to you and thanks to the Gazette for having us. I'm happy to be here with Mary and Courtney. Tim Wilson, and I chair the Iowa Council on Homelessness, of which I've been a member since for the past 10 years. And the Iowa Council on Homelessness is one of the boards, the governor-appointed boards and commissions, and this one's specifically charged with addressing homelessness across the state. Other folks, and we can probably talk about this later, are, I'm sure, aware of the fact that many boards and commissions are kind of on the chopping block pending legislation, and unfortunately the ICH is one of those. And I got into this work in 2009, when I became executive director of the Willis AD Emergency Services in Cedar Rapids.
All right. Well, I appreciate it. Look forward to the conversation. And I just saw a reminder pop up in chat. And for those that are joining us on the live stream today, we do have an opportunity to ask questions. You can do so using the Q&A button on your screen, and then we will work those questions in to our conversation here. And knowing that we have more than 400 signed up for the week, I'm anticipating there will probably be quite a few questions. And so we appreciate those, and we'll get to as many as we can. I wanted to start just kind of a little bit, Courtney and Tim, maybe talking about homelessness within the state and what it looks like. I'm sitting in Cedar Rapids, and I would suspect that of the 2,500 people in the last estimates that are homeless, it has a certain look and maybe harder to find in rural areas. But I was curious if you could talk a little bit more about how much do we know and how how is this being approached, in some of the rural, urban areas and some of the rural ones?
Courtney, if you want to get started, I know you've got some statistics. It's probably lots of statistics to share at some point. But please start, and I can add and talk about my experience with the homeless point in time count in rural areas.
Yeah, thanks, Tim. And I think a great place to start is the point in time count. So this is a required count that HUD requires communities to conduct at least every other year. In Iowa, our communities do it at least annually. Many communities do it every 6 months. So every January, we have providers, volunteers, community members that go out in the community and count those who are unhoused or who are sleeping in cars, who are camping, other places that are not meant for habitation. And that is our best sense of where our homeless numbers are at a given time, and how those changes are happening. So, and how we're seeing that. What we see across the balance of state data, specifically in the last 5 or 6 years, is that one, our numbers have gone up, but that is also in part to us counting better. We are actually going out into more of the communities, more of these rural areas, and getting a sense of who is homeless in those communities. So we'll see increases in our numbers, and some of that is an increase in homelessness, and some of that is we're just actually capturing this information in a more accurate way. So we did the point in time count at the end of January this year. We don't have those numbers yet. Our team is still working on getting those numbers. I anticipate that they're going to be pretty similar to the last few years, where we have around 300 individuals in the balance of state that are unsheltered or staying outside in a place not meant for habitation. Again, this is just one night, one capture, like looking at the data for one night. It is not a perfect data point for us to look at, but it does give us a sense of where our numbers are, and what resources we may need to really address those numbers, and if there is a significant increase, how we can make sure those resources are available in those communities. I don't know if I got all of those parts of the question, but I'll also, Tim, if you have anything you want to add around the point in time.
Well, yeah, Courtney, I would say we're getting better at it, but the accuracy probably varies more than we'd like at this point from county to county. I was trying to remember the other day how many rural counties I've done the point in time count, the street count, and this is probably good. We should point out to everybody, the point in time. There's two parts of the point in time count. One is the sheltered, and one is the unsheltered. And the sheltered, that's pretty easy because the shelters and the homeless shelters in Iowa provide the data, and they're used to that. With the street count, which is essentially what Courtney was talking about, and what I talked about is folks that are those places that aren't meant for human habitation. And it's a lot of people in parking lots, in cars, in trailers where all the utilities have been turned off. It's corn cribs sometimes, all of the above.
I was just going to ask how, when you talk about the data getting better, does that mean that from time to time there's consistency in who's doing the counting, and you're kind of watching over a period of time where people may be, or how do you there's a lot of geography in some of these rural counties to be paying attention to. I mean, there's farmhouses, there's all sorts of different things. How's that work done?
Well, it really it is very dependent at this point on volunteers, primarily from among the service providers, the shelters, the housing programs, the domestic violence programs. We're getting more help, and Courtney, maybe you can comment on this. We're getting more help from veterans, because there is obviously one of the groups that we're interested in getting demographic data about is the number of homeless veterans, which we've made tremendous strides on in the last decade of getting folks veterans housed. But it is not. We talked about the counties, and that's how the homelessness is measured, the unsheltered. But It's not like the county supervisors in Buena Vista County consider it part of their job to count the homeless folks. I mean, it really is up to the service providers, and it's not anybody's. It's not anybody's job. Nobody goes to jail or gets fined if the homeless count doesn't get done well in Crawford County. And I'm not suggesting that should be a punishable offense, but it's something that we struggle with.
Mary Frances, maybe you could talk a little bit about a lot of the work that you do is to help communities kind of develop processes and the systems, and how, as you're going into a community that's working to address this, what types of things are you wanting to make sure are part of that system and that intake, that process?
Sure. Thanks for that. Great question, Zach. So I think we actually start with the people that are closest to the problems in a community. The National Alliance was recently last year working in Cedar Rapids and Lynn County, and we start with the people. Although we have a national lens, we don't see ourselves as the subject matter experts on homelessness. So we have to rely very heavily on folks that are on the ground doing the work, but especially people who have either past experience, lived experience of accessing homelessness systems, and even current experience of homelessness to help inform our efforts. When we're working in communities, we are, helping them assess their system and see maybe what's working well, what could be improved. But I think it's important in the context of today's conversation to just give a little bit of background on where we are to kind of talk about some of those solutions. And what we know is that homelessness is up for the 7th year in a row nationally. That's a fact. But we saw more acute increases in 2023, which is the most recent data that we have available. Tim and Courtney did a great job of illustrating some of the challenges with the data. But if you think of it just like the census that's conducted every 10 years, it's our best educated guess of how many people are experiencing homelessness on a given night. And what we know based on the trends, the upward trend of homelessness, is that there hasn't been a lot of intervention in the housing crisis. And that continues to leave people with the lowest income earners at constant risk of homelessness. And in Iowa specifically, there's an estimated shortage of 57,000, give or take a couple hundred homes, rental homes that are both affordable and available for those folks that are on the lower end of the income spectrum. So, when we approach this work, we approach it with that in mind. We are in the middle of a really large housing crisis that hasn't seen a ton of investment. And rural areas often feel that lack of investment more acutely. I know that, no matter where we all come from, we all want to live a life that gives us joy and connects us to those things that keep us healthy. People just need a place to call home and the support so that when they find a home, they can stay in it. So that's kind of what guides our work. And that is, regardless, we try to treat this work that no matter how much we earn or the kinds of difficulties we may have faced, we all deserve to have a place to call home. So talking to folks on the ground in community, looking at those data sets, like the point in time data, but also the housing interventions that are available in communities, and making sure that we're not just focusing on traditional homeless services partnerships. So many communities rely on rescue missions and faith-based institutions. We try to get as many people as possible to the table to inform the work that we do, as opposed to coming in with a one-size-fits-all approach. And that's, some of the work that we started to do last year with Cedar Rapids and Lynn County.
And I'm curious, when you talk about the housing interventions, is that some of that preventative, so prior to, and responsive? How much are you looking at both the preventative services for people that maybe at high risk.
Historically, yes, homelessness prevention has been a subject of our focus. But what I will say is that, like, we have continued to house more people than we ever have historically, but people are becoming homeless faster than they can actually be rehoused. Many of our homeless response systems are doing excellent work. They just can't keep up with the volume. The resources aren't there. The staff capacity isn't there. Our systems are overwhelmed. Our social safety net just cannot keep up. So I think that when we look at homelessness overall, we do need to pay more attention to homelessness prevention. Preventing homelessness and addressing entries into homelessness is the single best investment that we can make in our communities right now. But the resources, again, historically for homelessness prevention, that really requires that you are like, but for this assistance, you will be on the streets in a place not meant for human habitation in your car or having to go into shelter. Does that assistance become available? But what we know is that there are some feeder systems, and that includes housing, healthcare, the education systems, foster care, elder care, all of these systems that are often feeders into homelessness. We've got to go a little bit further upstream before we reach the crisis of someone, say, for example, getting an eviction, or someone, recognizing that they're having some issues with their landlord and tenant relationship. So I think we have, yes, focused on homelessness prevention, but we definitely need to do more because our social safety net is in a place where it can no longer keep up. And that means people are falling through the cracks.
Thank you. I had a couple of audience questions that kind of go to the, I think, the universe that we're thinking about here. And so one of the questions that came in had to do with kind of a clarification. When you do the point in time counts, they do not count individuals or people that may be doubled up with others. Is that true? Or how do you work with that?
Yeah, that's correct. So the continuum of care operates within the HUD realm, so the U.S. Department of Housing and Urban Development. And for HUD programs, if someone is doubled up, they are not considered literally homeless. So that is different than the Department of Education, coming from an education background, and schools who have services for homeless children and youth. They do consider families that are doubled up as homeless, but that is not something that we are considering when we look at the HUD programs, and the point in time is one.
Okay, thank you for that. The other question that was kind of along the same lines, just in terms of counts, when you do the point in time research, is it important to look for unsheltered networks, like asking the people who are being encountered, do they know others, or or do you do that already?
I can speak to that, Courtney, because the last couple of point in time counts that I've done have been in Polk County, and networking it's amazing to us how whenever there are resources or information, how quickly it can spread within the network of folks who, and we're talking primarily about individuals and families who have been homeless for a while, like they're chronically homeless. That there are just there are encampments, there are pockets, there are people have cell phones, people have cars, and word spreads pretty quickly, sometimes amazingly so.
Okay, so you do kind of ask about others that they may know.
Yeah, right. Because and you're right. I should have put that in the context of the count, because word usually is put out in flyers and other information to say, hey, remember the point in time count. It's coming up. There's going to be in smaller communities, and is maybe some larger ones, it might be a dinner, a way to that you're kind of getting people together so you can do the count, that help do the count that way. In other ways, other times it's just hey, we're going to have kind of goodie bags with socks and protein bars and that kind of thing for folks. But the networking is important, and but this is a this is a 24-hour count. It is a point in time. So the importance of that networking, it has to happen before that night. It's got to be something that's done in the weeks and days leading up to it. But it's always in late January.
I wanted to ask a little bit about the rapid rehousing came up earlier, and I think that method is now preferred to just sheltering. Is that a true statement? And when you go to rapid rehousing, how do you how long of a process is that? And Mary Frances, you mentioned that you're not able to necessarily provide spaces for everyone that needs them quickly enough. I'm imagining there's a transition period, and I'm guessing there's a in practice and a best practice there. What do those look like?
I think that's a really great way to frame that piece up. Rapid rehousing is, how can I simplify this? So rapid rehousing basically follows the premise that if you can help people return to homelessness or return out of homelessness into permanent housing as quickly as possible by helping them find housing, helping them initially pay for the housing, and then helping them keep housing. So all that boils down to is if someone is experiencing homelessness, they would be eligible for it. There's no preconditions to eligibility, and they are attached to a service provider and a housing stabilization case management, which could have 1,002 different names. Doesn't have to be that, but the idea is that they are focusing on housing because we know research evidence shows us that when people are stably housed, they have an opportunity to focus on other areas of their life and get an opportunity to work on it. So it is a housing first model, which depending on who you are or where you live, that might be a controversial statement. We know that housing first, when implemented with fidelity to the model, so meaning, yes, we want people to go into housing, we want them to do it quickly, but they've got to have the right the right mixture of supportive services that are tailored to their unique needs. You wouldn't give, for example, a family of 5 the same type of case management that you might give to a young adult who's 25. They're going to be in 2 different spaces in their life, and they don't necessarily need the same things in order to maintain their housing. So rapid rehousing can work. It can be really effective. We've used it a whole lot over the last decade plus, and that has helped get people out of homelessness and into housing. And many of them have kept their housing. But as I mentioned earlier, we are in a very unprecedented time, particularly as we've emerged from the pandemic, where there were a whole lot of investments in funding for the safety net for communities across the country. And there's a little bit of a post-pandemic whiplash effect because many, not all of those resources are no longer available. And we are, again, we're seeing more people enter homelessness, even though we're rehousing more. If we can't prevent them from entering the system to begin with, we do find ourselves in a place of more resource scarcity.
I wanted to ask a question that kind of gets to the demographics of homelessness. And the question, I think there's probably an Iowa answer and then the national answer. Are you noticing more seniors and elderly becoming homeless, sometimes for the first time ever? I'm curious, Courtney, maybe is that something that you're seeing in the data that you get? And Mary Frances, I'm curious nationally.
Yeah, we've we definitely are collecting the information on the age of individuals as they're entering the homeless system. And so we are seeing more individuals that are older adults that are entering into the system. I don't have a specific number for you, but I think that we are very aware that that is a challenge, especially for a lot of our older adults when you're on a fixed income, and there are not affordable units when you have a fixed income. That's true across the state, that there's just not that availability of affordable housing for our seniors.
Yeah, and I just want to echo what Courtney shared. We are absolutely seeing an increase in older adults experiencing homelessness. I think current reporting for 2023 actually marks the first time that Point in Time Count collected data about older adults, which they consider age 55 and over, experiencing homelessness. And 46% of older adults experiencing homelessness are living outdoors, which is absolutely alarming. And for the, again, reasons that Courtney mentioned, we're in the middle of a housing crisis. A lot of our challenges in solving homelessness and putting an end to it once and for all has to do with housing affordability, access, availability. And I would even add that when you look at our aging population, for folks with mobility issues, even if we were to find an affordable and available unit, is it accessible? We tend to talk about access from different perspectives, but people who are aging often find themselves with disabling conditions and have accessibility needs. And that's not been something that has been a strong requirement of affordable and available rental homes. So just want to flag that as an even dire concern for our aging population.
And you've mentioned this several times, but obviously it takes landlords and developers working together on some of these projects. But I would imagine it takes communities as well. What are you seeing in terms of some of those best practices in addressing and working? This is different than the affordable housing, and to get median rent types of situations. What are some of the best practices that you're seeing in terms of communities working to address this for the long term?
Tim, were you coming off mute?
I am off mute.
Oh, I thought I heard you. I didn't want to dive in.
Yeah, no, please go ahead, Mary Frances. Yeah.
I mean, so this is how I'll respond. Great question, by the way. The communities that I've seen be successful are communities that are taking a whole of community approach. So not just making homelessness the responsibility of the homeless response system, but making it the responsibility of the whole of community. So business owners, faith-based organizations and institutions, members of the public, the education system, all of those sort of upstream systems. There's a real benefit from helping people stay stably housed, and that has to be rooted in the fabric of a community. It's an all hands on a deck approach. And to just give you an example, Los Angeles, I know Iowa's very different from Los Angeles, but they've got the one of the highest numbers of people experiencing homelessness outdoors there. They've been trying some new innovative strategies, including a master leasing strategy. So that's an example. That's a partnership not only with the COC, the Continuum of Care, as a planning body, but also service providers and developers coming together to say, listen, we know that, some of your folks, not all of them, may not be in a place where they've got all of the things that are typically required of a renter, a market rate renter off the street. Why don't we try this approach to get as many people into housing as quickly as possible? And it's a partnership that is looking actually beyond the existing resources that we have. Like, how can we do less with more? So I really think that communities who are successful are communities that really embrace the idea of collaboration and embrace the idea of having a unified approach to ending homelessness and preventing it from even happening in the first place.
Courtney, Tim, I'm curious if you see, you've got the rural housing crisis, and that's been something that's been talked about statewide for an extended period of time. But I'm curious, are you seeing, solutions tried in places that uh, are you give you some excitement and hope that maybe could serve as models to be tried elsewhere?
Sure. Well, a couple of communities, and Courtney probably gets out around the state more than I do, but a couple of places that come to mind. One is Grinnell, and the sort of community all hands on deck that Mary Frances was describing is very much a part of that. What Grinnell has done to address their homelessness. I'd also cite Ottumwa, which has a very outsized number of they have a very significant number of folks who are chronically homeless there, but they've also been doing a lot of community engagement from the mayor, city council, organizations, the housing landlords, and I know they've recently gotten some funding for affordable housing, and probably from more than one source. But I know as part of the continuum of care funding, they have within the last couple of years been able to create some funding. I think it's also important, and Courtney may have something to add to that, but I think it's also important in looking at solving homelessness and a community level is that we're looking at the housing availability, and I know that's been touched on earlier, but for instance, it doesn't really help, and you see this on the West Coast in great detail. It doesn't really help when you create jobs that are at nobody, I guess, creates jobs at the minimum wage anymore, but lower wage jobs for in a community without either in place already or plans to match that with housing that meets those income levels, because then you're either saying to people, you're going to live in substandard housing, or we expect you to drive 2 or 3 hours to get to work every day, or you're just saying, yeah, it's fine that our employees are homeless as long as they show up for work, and none of those should really be acceptable.
And I think I'll add to what Tim said. He noted that there has been some additional funding that has come in to rural areas. So we, as the Balance of State, had applied for a special funding through HUD specifically to address rural homelessness, and we're awarded nearly $5 million over a period of 3 years to address rural homelessness. Now, I should say that we are really excited for these 6 housing projects. They certainly do not encompass all of rural Iowa. So there still are some parts of the state that don't have the resources, but we are really excited about these 6 housing projects, many of which are coming in areas that have not had continuum of care funding in the past. So this is really exciting to have this opportunity. So in areas like Tim mentioned of Grinnell and Ottumwa, but also in parts of Northwest Iowa and Muscatine and other communities. So it really does spread this across the state. And those projects, most of those projects have started within the last month. So don't have a lot of information on those and what that impact will be. We should have that, in the coming months. HUD is very interested in what this looks like, and are we able to effectively reduce rural homelessness through these funds? So we'll certainly have more to share on that down the road, but I'm really excited about that investment that is coming into rural communities.
we had an audience question, and they asked, how long does rapid rehousing typically take? Is there um, a target, or um, how do you address that?
So it is supposed to be tailored to an individual household. And when you're serving a high volume of households, that can be challenging to do. However, rapid rehousing, according to the funder, which is HUD, can last for up to 24 months. However, in order to serve more than, a small number of households, you're ideally using more of a progressive engagement approach that is tailoring and targeting the financial assistance and the supportive services via case management, connection to mainstream resources that might exist to help them get stabilized and in a place where they can pay for their own housing without any subsidy. And maybe, drawing the services back over time, but doing this again in a very targeted manner that's tailored to a household. So I think that goes back to what you said earlier, Zack, about what happens in practice, maybe not always lining up with the ways in which programs are intended to be. And that, that's common. We lose fidelity all the time. And there are some great providers, including those in Iowa, that are doing really excellent work around the state.
I am curious a little bit on the wraparound services or some of those other supports that are needed. And I think they exist, and they're maybe more reachable in some communities than they are in others. How big of an issue is that to make sure that you're able to deliver or design the right levels of supports? And how big of a barrier is that to being able to have successful transitions?
I mean, much of the focus of today's conversation has been about the distinctions between like more urban homelessness versus rural homelessness. And I believe that we should name all of the challenges that rural communities are up against. There's often a perception that there are lower rental prices in rural communities, which there are, but wages also tend to follow and be lower. I know Courtney talked about just the huge size of the balance of state COC. My gosh, all of the counties in the state except for 3, that's a huge geographic area. And we know that in rural communities, they don't tend to see the same saturation of nonprofit providers that you might see in a major city. The lack of housing stock is going to be more acute in a larger area. So we know that there's not enough housing for extremely low incomes, but then you talk about services and what that looks like. You're going to have transportation barriers. Not everyone is going to have access to the services that are offered. There might be regional hubs throughout the state where people actually have to go, as opposed to having services that can come out to them. Despite all of these challenges that I'm naming, there is a certain, they're often trusted partners in rural communities, and they just are really excellent at coordinating resources and making things happen. So I'm excited to hear that Iowa Balance of State got money specifically for rural. That is a newer-ish priority at the federal level, and I'm hoping that we can continue to make sure that rural homelessness gets the visibility that it deserves and that the resources follow that visibility. Because, we've got to make sure that people in rural communities are seen and heard and resourced adequately so that they don't have to sleep outdoors.
I had another question that came in from the audience. What are folks doing to promote equity in housing? Who's being disparately impacted by homelessness, and what's being done to reduce the disparities?
Courtney, do you want to talk about the study group?
Yeah, I mean, we are very aware that there are disparities in our homeless system. So we worked with our homeless management information system, our data reports staff to do an analysis of our the balance of state system, and recognized that we are in fact seeing those disparities, like just as expected, that more people of color are experiencing homelessness and seeking services than more people of color are homeless than there are that similar percentage in the general population in Iowa. So that certainly does exist here as well. And there are some disparities in terms of the number of people of color who are getting access to permanent supportive housing, which is the highest highest level of intervention that is available. We haven't talked about that a lot. We've spent a lot of time talking about the rapid rehousing, but permanent supportive housing, just as it sounds, is permanent, long-term housing, often for those who have been chronically homeless, so have been homeless for long periods of time, have a disability, and really need more supports than that 12 months or so of the rapid rehousing. And we are recognizing that if we hold other things constant, that people of color are not getting the same access to those permanent supportive housing units that are available than white individuals are in the balance of states. So we are still working through how we move from having this information to making sure that we can really make an impact on that. And I think the challenge is also that this obviously addresses a whole host of other systems that have to come together and be also willing to address this as well. So we are not something that can operate on our own. We need the benefits of our healthcare system, our criminal justice system, the education system. All of those other pieces need to be in play and need to be willing to come to the table to have some conversation of how to make that change. And I don't know that we have yet gotten to that point to have that conversation.
And Zack, if I could, I would just build off of what Courtney said. What we're seeing nationally aligns with what Courtney just reflected back very explicitly. We see deep disparities with people who identify as Black and African American. They are the largest group that has that disproportionate share of homelessness throughout the country. But we also see it in Native Hawaiian Pacific Islander populations. We also seeing it in, there were some sharp increases in the last point in time count information. American Indian, Alaska Native, folks that identify as Hispanic or Latino, and Asian American had the sharpest increase, I believe. Which it lets us know that there are some aspects of our system that need to be adjusted. Yes, a lot of that does have to do with those feeder systems that myself and Courtney talked about earlier. We've got to have that whole of community approach, and we've got to reconfigure our broader like social safety net system so that it can actually function in a way that works not just for some, but for all people, regardless of who they are, how they identify. I would also add one more piece. There is a lot of conversation in the homelessness field more broadly about these disparities. And there are a number of communities that are taking small steps to figure out how to address these disparities. And you'll hear me say this probably a couple more times before the day is up, but people who are closest to the problems have the solutions. And that is one reason why there is really, really deep value in talking to people who have accessed your system. They can tell you exactly what their experience was and make suggestions on how to improve for the next person that is coming through the system.
Mary Frances, I wanted to kind of follow up on that point. When you're working with communities, sometimes there's, maybe politics gets into the mix, or maybe competitiveness between different agencies can get into the mix. How do you work through those types of scenarios? How do you diffuse that? And who do you look to as the oracle to kind of get past that?
Oh, that is a very tough question, Zach. I think it looks different from community to community. I'm an outsider, right? I'm an outsider when I come into communities, so relationships are critical. I have to develop relationships with folks that are on the political end of the spectrum, folks that are, just concerned citizens, and that like there is the same way there's a continuum of care, there's a continuum of opinions. But it is my belief that there is no one size fits all approach to homelessness. I always listen to perspectives that might be different from the perspective that I've developed over my almost 17 years in this field of work. What I know is that genuinely, and I've worked in communities as far as Anchorage, Alaska, down in, Atlanta, Georgia, on the West Coast and in between. People actually care about one another. So being able to tapping into the idea that we care about our neighbors, we care about our community, we care about our public spaces, and that we can come to a common ground in order to make progress towards preventing and ending homelessness. So I guess my approach is meeting people where they are and helping them move along at a pace that they're comfortable with. I also work for the National Alliance to End Homelessness. One of our biggest areas of work is research and evidence. So having that research and evidence, sometimes it is super helpful for folks that are into that. But other times just using my own experience. I've, worked on the front lines. I'm not just at a national organization, like right out of college or something. I've actually, worked in an emergency shelter with families, and I've worked with single men in emergency shelters and drop-in centers and homeless resource centers. So I've experienced, I have my own professional experience of working with and engaging people. And I usually say this when I'm kicking off a training, I'm from the old school way of addressing homelessness. I didn't wake up one day brimming with joy for housing first approaches. I had to become a believer by changing the way that I thought and changing the way that I worked with people. And over time, I became a believer because I saw it work. And what that meant for me was that people that were coming into the shelters that I was either a case manager at or eventually a program manager for, they were getting homes of their own. And that's like, what greater gift of service than to help people get into their own home and stay in their own home through these practices that I might have been a little skeptical of previously because we were doing things in a different way. So I share a little bit of professional experience, meet people where they are, and also offer research and evidence that shows that like we can actually do this.
Okay, I wanted to ask another question that came from the audience, and I think one of the questions is along the lines of, if you build it, they will come. And so the question that was posed here was, it seems like there are a lot of low income housing options coming online in Cedar Rapids. Is there some prediction about how these new housing units will affect the size of the homeless population? And I'm curious, how do you address that kind of concern?
I think there's a lot of misconceptions around homelessness and where the homeless are coming from. We hear a lot in various parts of the state of Iowa that, well, we don't have any homeless here. They're all coming from Chicago or someplace else. That is absolutely not true. And we see time and time again in our information that most people that are experiencing homelessness in Iowa are from Iowa. They may have to move within the state to access resources because we've talked about many of these rural communities don't have an overabundance of resources, may not have shelters available, that sort of thing. So they may not be originally from Cedar Rapids or Lynn County, but a majority of the individuals that we are seeing in our homeless system are from Iowa. Now, that's not to say we don't see people that are coming from other parts of the country. That is in fact true. But most people are coming from within the state. And I think, cannot speak for certain around, all of these units that are coming online in Cedar Rapids, but I would say, I think there's a need for these in Cedar Rapids. There's a need for these in many places in Iowa. And so having those availability within your community is really going to be a benefit to the community, so that you are able to house individuals that are from Lynn County in their community and in the place that they want to live.
Okay, thank you. Tim, I wanted to ask, you brought this up in your opening comments, but you're representing the Iowa Council for Homelessness, and it is one of the appointed commissions that is, I guess, phased or suggested to be phased out. Obviously I can guess that there's some concerns with that idea, but what do you see what would the impact of that be, and how fragile, are these statewide kind of collaborations, and are there some alternates that maybe should be considered here?
Sure. Well, there's kind of two aspects to that, Zach. One is that the council has been kind of a forum where where providers, homelessness and housing service providers could have conversations, learn about resources, some of the resources that Courtney has talked about, and then on occasion take action in terms of advocating for or against policies. And that, I think, we're working on ways to be able to continue those conversations for service providers. But the other aspect is this is kind of a model based. I can't say it's based on, because it actually preceded the federal interagency council on homelessness. But the idea that we had, unlike I think most of those boards and commissions, we have representatives from the Attorney General's office, from the Department of Education, Department of Veterans Affairs, Department of Corrections, and without that mechanism for the conversations to take place, for where federal resources typically pass through those agencies, we want to make sure that's where those conversations at one level at least have taken place, and we want to make sure that continues. And I know that Iowa Finance Authority Director Debbie Durham is committed to making those conversations happen, but we want to see that when there are resources out there that for which Iowa would be eligible, that would be helping address homelessness and helping with both prevention and getting folks out of homelessness as quickly as possible. We want to make sure those are that the federal agencies are responding, applying for that and getting data to support applications and so forth. And that's, I guess, where we're kind of, that's a little bit more up in the air about how that's exactly that's going to work.
Yeah. So a couple, I know we're tight on time, but I wanted to get to a couple more questions before a closing question. Does bringing on low-income housing reduce homelessness, and how much of an impact does that have in a community?
So I'll be brief, anytime you bring on new low-income housing units, that is a huge benefit for the community. There are studies out there that show that existing home property values are not compromised by low income or other affordable housing. So that's a net positive for a community. Where it gets tricky when we're talking about the correlation between low income housing and reducing homelessness is that people who are homeless are often in the lowest tier of an income spectrum. So thinking that according to like an area median income, there's a possibility that they could be 0 to 15% of an area median income, which means, and I'm just going to say someone who is receiving Social Security disability income, they are often priced out of low income housing. So it really is going to vary whether or not it'll have an impact depending on who the target of low income is. If it's 0 to 15% AMI, great, it could have a huge impact. But does it have a seniors restriction? Like, is it just for aging people? Does it have some other type of restriction on those low income housing tax credit properties? Because we often see that they do. I hope that gives you a little bit more context.
Mm-hmm. The other question that came from the audience is, what's the breakdown among Iowa shelters that are high barrier versus low barrier? And is there a discussion on expanding low barrier philosophies further?
Yeah, I don't know that I have a number specifically on how many are high barrier versus low barrier. I would say a lot of our larger shelters that are able to house more individuals are low barrier shelters, but we have a lot of smaller sort of faith-based rescue mission shelters across the state, and those are often higher barrier shelters. Now, we certainly are aware of this and want to engage with those higher barrier shelters, but there's not always a benefit to them. They don't receive any funding that would require them to get to a low barrier shelter, and so they may feel that it is their mission to support only those that are sober or something along those lines, and that is certainly a need and that exists in our community, but we certainly need more low barrier options that are able to house anyone and connect anyone with a safe place to shelter.
Thank you for that. We have about 2 minutes left to go here, and I wanted to ask kind of a closing question, and it's one that we ask in a lot of these sessions. If you were, all things being equal, and you had the opportunity to impact change, what is one thing that you would do, or what is the thing that you would do to bring the greatest change to homelessness? Is there a policy tweak, or is there some sort of adjustment that you would make that you think would have a big impact?
I'll start and be quick. Mary Frances referred earlier to the fact that there's not one size that fits all, but I would love to see Iowa have more tax credits for developers, so that so that they could recover their investment in affordable housing at least 30% AMI and lower. Recover that quicker so that we got more housing.
I tend to be a radical thinker, but I'm just going to say this. I think if we were to take all of the shelter beds, if there were 3,000 shelter beds in the state of Iowa, I would take all of them and renovate them and turn them into permanent housing. And then all, 3,000 or slightly less of those neighbors who have been homeless can experience the joy of thriving and contributing their strengths in the state, because they won't be homeless anymore.
And I would say I would love to see some state investment in homelessness. Currently, the state invests only a percentage of the real estate transfer tax, and that goes specifically to shelters, which, as we've talked about, very necessary, but there is no state investment on the actual housing side of things. And so would love to see some investment from our state in that capacity to really make a change in this and more solution focused.
All right. Well, this was an incredibly fast hour, and I want to thank all three of you for joining us today and kicking off this in-depth week. We have programming at noon each day, the remainder of the week. Tuesday, we have supporting homeless populations with unique circumstances. Wednesday is stitching the patchwork of homeless resources together. Thursday is housing vulnerable populations. And Friday is policymaking to protect housing is a human right. So each of those kicks off at noon and is accessible free thanks to presenting sponsor ITC Midwest. And thank you all for taking your time today in this discussion of major importance across the state of Iowa. So thank you, everyone, for your time. Have a great day.